We are going to begin with the second part of our day. My personal favorite, because the student presentations, and there's always so much excitement about, maybe doing one of your last presentations for some. So to kick things off, I want to welcome the student group from Health Informatics. Come on to stage.
Good afternoon, everybody. My name is Hanna Mampallil, and this is my partner, Jessica Mathew. And we will be presenting on the effect of health disparities and barriers on maternal health outcomes. To get started, maternal health it refers to the health of women during pregnancy, childbirth, and the postpartum period. Maternal health is a critical public health concern that reflects the overall well-being of society and the effectiveness of its healthcare systems. Despite advancements in medical care and technology, disparities in maternal health outcomes remain a persistent challenge, especially in the United States. In 2023, the maternal mortality rate, also known as MMR, was 18.6 deaths per 100,000 live deaths. Such disparities highlight the need to address underlying determinants, including access to care, implicit bias in healthcare settings, income inequality, and barriers to culturally competent care. Maternal mortality and morbidity rates among minority populations and these inequities are driven by a complex interplay of social, economic, structural, and healthcare-related factors that systematically disadvantage marginalized communities. Failure to resolve these inequities perpetuates cycles of poor maternal health outcomes and widens existing health disparities. As you can see here, this chart vividly illustrates the stark disparities in maternal mortality rates between the United States and other industrialized nations. The U.S. MMR is nearly 3 times higher than of France or Canada. This disparity calls into question the effectiveness, equity, and accessibility of the U.S. healthcare system, especially regarding maternal health. In our literature review, we found that Black women face significantly higher risks of maternal mortality and severe morbidity compared to other groups. This provides a conceptual framework for studying structural racism and synthesizes empirical evidence linking it to adverse maternal health outcomes. We also found that social determinants of health, such as living, working, and aging environments that influence maternal health outcomes. Poor housing, unsafe jobs, lack of paid leave, and limited resources increase stress and reduce access to prenatal care, worsening maternal outcomes, especially for older and marginalized women. Lastly, we found that health insurance coverage significantly influences maternal health outcomes. Health coverage significantly improves access to specialized, preventative, and primary care for women, supporting better outcomes in maternal and reproductive health. States that have expanded Medicaid under the Affordable Care Act have seen gains in coverage stability and increased postpartum care. Besides that, racial disparities still remain. Women of color face higher uninsured rates than white women throughout pregnancy and postpartum.
In this study, we're focused on identifying and analyzing the main factors that contribute to disparities in maternal health outcomes across the U.S. These differences in outcomes are not random. They're closely linked to factors such as ethnicity, geographic location, and socioeconomic status. This is a critical issue because unlike other high-income nations, maternal mortality rates in the U.S. are still rising. Our study examines the primary contributors to these unequal outcomes and assesses how they impact maternal health. So for this study, we're using a quantitative cross-sectional secondary data analysis design. Our main focus was to explore how ethnicity and geographic location impact maternal mortality across the U.S. from 2018 to 2022. We used data from the CDC's provisional maternal death count, and that was compiled by the National Center for Health Statistics. To ensure consistency and comparability, all mortality rates were reported per 100,000 live births. The dependent variable is the maternal mortality rate, and the independent variables include ethnicity and geographic location. Cases were excluded if they had missing information and in order to maintain accuracy. We used Tableau and Excel to visualize these public health records. The visualizations used help show state-level mortality rates, trends by ethnicity over time, and highlight states with the highest and lowest rates.
For analysis, our results were produced from maternal mortality data that was analyzed from 2018 to 2022. We grouped them by age, race, and ethnicity, and by state. The following slides coming up next depict trends over time in racial and ethnic disparities and geographic differences in mortality rate. These graphs specifically identify geographic areas with the highest and lowest maternal mortality rates, laying the groundwork for understanding regional risk disparities. First up, we have a heat map, which visualizes maternal mortality rates by state in the U.S. with color intensity indicating the severity of rates per 100,000 live births. Darker red shades represent higher MMR, while lighter yellow shades indicate lower rates. The map shows that southern states such as Tennessee, Mississippi, and Louisiana exhibit the highest MMR rates, with values reaching up to 41.1. Western and north and eastern states such as California, Washington, and Massachusetts are shown to have significantly lower rates, closer to 10.5. States in gray indicate areas where data is unavailable due to reliability or confidentiality limitations. Building on the regional patterns we just saw, this slide offers a more detailed comparison of individual states. Specifically, it highlights the states with the lowest and highest maternal mortality rates between 2018 and 2019.
So this is a clustered bar graph that shows maternal mortality rates broken down by ethnicity. As you can see, Black women consistently experience the highest maternal mortality rate. The rates in this group peaked in 2021, reaching nearly 70 deaths per 100,000 live births, which clearly highlight a major disparity. In contrast, white women have moderate rates that fluctuate, peaking slightly in 2021 and declining back in 2022. Asian women had the lowest rates overall, and remaining stable and consistently under 20 per 100,000. Hispanic women showed an upward trend in 2021, but experienced a decline in 2022. Overall, these rates in 2021 and 2020 coincided with the peak during the COVID-19 pandemic, which strained healthcare systems, limited access to prenatal care, and disproportionately affected marginalized communities. Our analysis observed the maternal mortality rates in the U.S. significantly varied by ethnicity and geography. Black women consistently experience the highest maternal mortality rate nationwide, underscoring deep-rooted disparities in care. These disparities are driven by unequal access to quality care, higher burden of chronic conditions, implied bias in clinical settings, and systemic racism. Geographic inequities were also clear. Southern states reported worse maternal health outcomes, largely due to under-resourced systems and a failure to expand programs such as Medicaid. A comparison between states showed that California has achieved a lower maternal mortality rate through Medicare expansion and strong public health initiatives, whereas states such as Tennessee faced higher rates due to provider shortages and a lack of Medicaid expansion. Additionally, over half of U.S. rural counties are classified as maternal care deserts, which means that they lack adequate services and force women to travel long distances for care, which often leads to fatal consequences. Insurance coverage also plays a critical role. In states such as Mississippi, which have high uninsured rates, they typically see worse outcomes compared to states such as Minnesota, which have broader coverage. These findings point to a need to implement targeted interventions that address both clinical risk factors and broader social determinants of health. Now, one key limitation of this study is that rates that were fewer than 20 maternal deaths per 100,000 live births are less statistically reliable, which introduces greater variability and wider confidence intervals. There was also limitations with potential sample bias from underrepresented or less populated regions. There was also a risk of selection bias due to inconsistent recording. Additionally, certain data was rendered unavailable due to recent executive orders.
In conclusion, our analysis confirms that maternal mortality disparities persist in the United States. While national maternal mortality rates have fluctuated over time, racial and regional gaps have remained consistent. To address these disparities, future research should include qualitative and longitudinal studies that explore the root causes, including structural racism, policy barriers, and access to care. Additionally, evaluating the impact of Medicaid expansion, studying maternity care deserts, and assessing the role of telemedicine and mobile health units could help develop more effective ways to help maternal health outcomes become better. And thank you for listening to us. We hope you enjoyed our presentation, and we would like to give a special thank you to Dr. Kaufman for helping us throughout this whole process.
Wonderful, thank you. Thank you so much for that.